Melissa Cooke. I'm a patient resource navigator for the Head and Neck Cancer Alliance. We serve head and neck cancer patients and their caregivers, as well as healthcare professionals. And really, we look to support all of our patients and our caregivers and survivors with resources and programs to help them live their best lives. So our website is a really great place to find information. It's www.headandneck.org. And we have tons of educational resources about side effects, about the cancers themselves, and all of our different programs. Some of our programs that are available to all of our patients and our caregivers for free. We have a peer-to-peer program where you can call and speak to someone who may have a similar diagnosis as you or a similar journey as you. And that's also available for caregivers. We have a $50 financial assistance program for patients who are currently undergoing treatment. So it's a gas card, a Walmart card, or a Target card. It's a one-time thing. We do ask that medical professionals fill out the form for them. So that helps us to weed out any fraud. But it's only about a 2-minute form. It's really simple and easy to fill out online. And most of our patients end up being eligible for it as long as they have head and neck cancer. Then we also have a really active online supportive community through Inspire. It's kind of like social media for head and neck cancer patients and their caregivers. And we have a policy that no post goes unanswered. And in the year that I've been working in this position, I'm one of the moderators. I've only ever had to answer one post, and there were lots of answers after me. So it's certainly a really wonderful, welcoming, and supportive community, and a great place for people to ask questions that maybe they didn't have time to ask their physicians, or that they were too embarrassed to ask, or that they're just wondering about at midnight and can't talk to anybody about. So that's a wonderful resource that we have as well. It's also April. April is Awareness Month for head and neck cancer. We do our big fundraiser in the month of April. We have a move-a-thon, which is to primarily raise awareness about head and neck cancer and the fact that moving and exercise is so good for your body when you're a cancer patient, but also for our caregivers as well. It's great to get that exercise in and that movement into your daily routine. And so we try to promote that with our move-a-thon, as well as raise some funds. We have teams around the country who are working to move their way through their cancer or in memory of someone, and help to raise awareness and funds for Head and Neck Cancer Alliance. We have a lot of other programs as well. I'm starting a new caregiver support series with UCLA. We're going to start small, but it'll be a 12-week series where caregivers will meet virtually. On even week or odd weeks, they'll have an educational topic like an introduction to head and neck cancer, or nutrition, or emotional and mental health issues. And then the following week, we get together as a group and talk about it in a support group style conversation virtually. We also have lots of information online that you can download. We have brochures that you're able to download and hand out to your patients, or we can send them to you at your facility if you contact us. And then we also will help to support different facilities. If your facility is wanting to do a screening program for head and neck cancer, we'll help you to run that event. We send out t-shirts and forms and help you to promote that particular screening event. So again, the month of April is a great time to do it because it's Head and Neck Cancer Awareness Month, but anytime during the year is wonderful as well. Our peer-to-peer program, and we also have an ambassador program that I failed to mention, but with those programs, these are people who have already been through their cancer treatment, and they really probably didn't have such great support themselves when they were going through it. And so to be able to offer that support to somebody and to lend that ear to somebody with head and neck cancer, it can be fairly disfiguring. It can also be very difficult on their speech and their swallowing. And so that communication piece of it is huge. When there's somebody who, doesn't know if they're going to swallow again, or doesn't know if their speech is going to be the same again, to be able to talk to somebody who's on the other side of it and into that kind of new normal setting where they're living their life, they're having a good quality of life, to be able to speak to that when you're in the thick of it and you're still maybe going under radiation, or you just had a flap put in from surgery and your tongue doesn't move the way that it used to. Trying to wrap your brain around that is very difficult when you can't see the end result and what you might look like a year from now. And so being able to contact somebody and talk to them and say, what was your experience like? Or how are you now? What are you doing now? Do things get better? Just to have that voice of experience, I think is super important for these patients, and gives a little bit of hope, right? And so that's actually one of the programs I really like the most, and I think is fairly unique to our company, in that we really help to promote that and have a pretty robust group of individuals who like to help other people through it because they know that they had a hard time. So yeah, I think it's definitely a program that's worth investigating and telling your patients about. We have a lot of laryngectomies who work with us. There's a couple of groups, the IAL and Larry Speakeasy. They're international groups for laryngectomy specifically, and they've unfortunately lost some leadership in the last couple of years. And so they are actually approaching us as a nonprofit to say, hey, can we take on some of that leadership role within the laryngectomy community? Because of course they are head and neck cancer patients. And so we're really excited to be able to work with some of the leadership that remains with those companies and trying to help cross-promote some of those resources specifically for laryngectomy patients and give them a little bit of community within our community. We just launched a new website, and so we're continually updating some of our educational resources. And so keep an eye on the website, keep visiting it, because we're going to be adding more and we're going to be updating our resources and things like that. So laryngectomies is definitely one of those areas where we're going to try and expand some of those resources. We really hope to continue expanding our reach to individuals across the country and across the globe. We do have some international sites that we can partner with, but definitely even here within the United States, we have great reach with some of our larger university academic medical centers because a lot of our board members are there and we love them and they support us and they help to spread the word about the Head and Neck Cancer Alliance. But what we are finding is that those patients that really need our help are the ones who don't have as many of those resources available to them through their hospitals. And so we are really trying to reach those people more in those rural centers or some of those nurse navigators who are on satellite campuses and things like that, so that they know, even if I'm not being treated at one of these large medical centers, I still have support. I still have resources available to me to be able to get through this treatment, to be able to come out on the other side and to enjoy survivorship and deal with the issues as they come up. And that's why we're here.